Okay, record dah.
Dah start?
Okay, dah start.
Alright.
Okay.
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 Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Akil bin Muhammad Syafi'i, and today I and my friend, which is
Muhammad Irfan Fadhi bin Muhammad Anwar.
okay. So today we'll be going to do a short forum about patient safety. As we know, patient safety is something that important, and it is a subject or a topic that we just learned before in our class. So basically, in order to improve further and also make us better acknowledge the patient safety, we will discuss about what is the patient safety, what is our opinion, what is the further improvement, and also lastly, the conclusion of it. Okay, so firstly, let me start with what is the patient safety. Okay, based on my opinion, patient safety is the absence of preventable harm to a patient during the process of healthcare and reduction of risk of unnecessary harm associated with the health care to an acceptable minimum. An acceptable minimum refers to the collective notions of given current knowledge, resources available, and the context in which care was delivered weighed against the risk of non-treatment or other treatment. This is the term of patient safety, which is come up by the World Health Organization, that referring to about the patient itself. Okay, so let me ask Brother Irfan,
Yes,
what
okay.
is patient?
Okay, in my opinion, patient safety is a discipline in the healthcare sector that applies safety science methods toward the goal of achieving trustworthy system of healthcare industry. Okay. It also an attribute of healthcare system. It minimizes the incidence and impact of and maximize recovery from adverse events. So it's almost the same as your opinion just now, Akil. Okay.
Okay, thank you. It was a very nice explanation because I can
Okay, my internet has problem. Okay, you are stuck right now. Okay. Okay.
to exposure to medical medicines or any diagnosis of condition. This definition is concrete but incomplete because so many practice have not been well studied yet. And by doing this thing, we actually could reduce the probability where the patient could be harmed. And from my opinion, there are two patient safety that I think the most important, which is first, uh, each hospital should have a very good design of the building, because through the a very good design, actually patient, it will make the patient safety much better. Let's say if in a hospital there are the toilet are far from the patient place, so basically the patient need to walk farther to reach the toilet. So basically, if the hospital have a very near toilet to the patient bed, so basically patient doesn't have to move farther. And second is like the stairs. Let's say if the stairs was too high, actually it could become like it could make the patient less safety, because due to that reason, there are many lifts at the hospital so that it could help the patient, so in order to make themselves not harmful. Okay, so can I ask you,
Yes.
Brother Fatih, what
Yes.
is your further opinions about the patient safety?
In my opinion, in patient safety, that we must improve the system in the hospital and the environment the patient and patient safety must have transparency and patient engagement. That means, what is that means? That means doctor openly discuss risk for safety events with patients and families and encourage patient to speak up. So if patient doesn't want this, doesn't want that, and they can tell doctor, patient, the doctor will know what is more problem, what is the problem with the patient, and if if the patient doesn't want to do operation but endangered his life, the doctor must be more must explain more about his health his health and try to persuade their family so that the patient will not die. Okay, and the
Yes.
and they also need to break down the shame and blame culture. You know, shame and blame. Uh,
Yeah. Yes.
yes.
Right.
Healthcare professional must rely on cultural intervention that promotes teamwork. You know teamwork? Yeah.
Yes. Like one
And,
part, right?
and collaboration and communication. If there are no teamwork and collaboration and communication, then the patient will most likely to die early, and
Yeah.
the, there is, of course, the doctors to blame. And avoid isolation and fragmentation. Okay, do not
All
isolate
right.
your doctor friend. Okay,
All
uh,
right.
okay, that is just my opinion.
Okay. So, next to the next question. What is the further improvement that we could do in the patient safety? So basically, from my opinion, in order to reduce the medicine error, which is including the giving of the wrong drugs or medicine to the patient itself, that's why there need to be have a, a occupation which is the medication safety officer, and also the pharmacist and the physician, which is they will take the prescription from the doctor, and then they will giving the right dose and the right time, so that the patient will know when and will when that they will take the medicine. And this is important because we need, in order to increase the pharmacological activity of the medicine itself, which could make the patient become more healthy faster. And second, about the diagnosis error, which is the diagnosis uh, in a patient, that should be have work occupation like the patient safety facilitator, which will which their work is to facilitate the patient in order to taking the right history of them, and also their works like the doctor itself, which should have a better knowledge about taking the history of the patient, and other workers like the x-ray, those who do the x-ray, because this actually could help the patient to have a better diagnosis, so that the doctor will prescribe a better medicine for themselves itself. All right. Okay. So, what do you think about further improvement in the patient safety?
I think the patient safety we need to improve in the aspect of patient engagement. If the doctor try to engage with the patient, right? You want to talk with the patient. If you don't communicate correctly with the patient uh, will not help you, and you won't know his disease or her disease. That's why we need to have a correct way to communicate with the patient and uh, with with them correctly lah.
Mm.
Uh, and
Yeah.
also the doctor and nurse will should they should get enough rest. You know why? Because if they have rest, their work will improve. So what if the doctor and nurse did not rest well? They are most likely to cause mistake, and may, this mistake may be small in the eyes of everyone, but in the eyes of medical aspect, it may be big. If the nurse accidentally give extra dose or not enough dose, then this will affect the patient, and the patient will most likely to die. Okay, okay, that's all for me. Okay,
Okay. So we actually reached our ending of our discussion today, which is about
ending.
the patients. Okay, so, as a conclusion, I think patient safety is the cornerstone of high quality healthcare. Much of the work defining the patient safety and practice that prevent harm have focused on negative outcome of care, such as mortality and morbidity. Nurses are critical in the surveillance and coordination that reduce such adverse outcome. So based on my opinion, I think all of the healthcare workers actually need to work together, especially the nurse and the doctor, so that they could what I say what I mean is they could ensure that the patient itself could be better in the future, and they will not harm the patient itself. This is important, not just to make sure that the patient itself, but also that the doctor will not be harmed by the consequence if they give the wrong things to the patient. What I do mean is, like if sometimes if the doctor was giving a wrong thing to the patient, of course the patient will sue the doctor, right? So basically, we want a benefit things to occur. We doesn't want a benefit and then something bad occur. That's why it is important to ensure that the patient is safe, so that not just the patient will also save, but also the doctor will save itself. That's my opinion. Okay. So how about you?
I think my opinion is as the same as you. Okay, the
Hmm.
all of those aspects will must be increase their efficiency, and so that everyone will have their own benefit. Okay, that's that from me, Akil.
All right.
All
Thank you.
right, thank you, Akil. Start recording ya.
Tarika.
Okay. Ya, tak apa lagi record je. Okay, start recording mana?